ukuya ngokwe-calendar ye-health, iviki uma licala lithi 6 March until ngezi-12 zikaMashi, iviki lapho kuxwayiswa khona ngesifo samehlo lesi sibizwa ngokuthiwa i-glaucoma, phecelezi i-World Glaucoma Awareness Week. Namhlanje kwezempilo zamutakalo sifuna ukwazi kabanzi ukuthi ngabe bahlose ini ngaleli viki, kanti kuma studio ethu sina Dr. Fikiswa Nomnqa oyiyena i-ophthalmologist ozosithatha asibeke ngalolu daba. Ngikwamukele Dr.
Thank you, Dr. Prue.
Uma ungambekela umbukelo osekhaya ukuthi ubani uDr. Fikiswa Nomnqa?
Okay, Dr. Nomnqa is an ophthalmologist, or else what is called an eye surgeon ngabanye, because umsebenzi wethu involves medical treatment yamehlo as well as surgical treatment yamehlo. So ngifunde eVets as a specialist, and I've been a specialist now for 4 years. I studied medicine, and I've been working in ophthalmology for quite some time, almost 10 years in ophthalmology.
Kanti ukufundela ukuba yi-ophthalmologist kuthatha isikhathi esingakanani uma uqala nje ngale MPCHB yenu, kuthatha isikhathi esingakanani?
It's a long road. Ithatha isikhathi eside, Doctor. You will know MPCHB or MBBCH is a 6-year degree, fundela uba ngu-doctor. And after that, unale 2 years of internship, and then you have a year of community service. And then after that, you can actually start to specialize. But it depends on the field of how long it will take for you to get into that field and actually specialize. So specialize, it takes about 4 years to become a specialist. So anything between 12 to 15 years, really, that's what you're looking at to become a specialist.
Akudlalwa lana kuyafundwa 15 years usesikolweni. Dr. Njengoba kuthiwa iviki lapho nixwayisa khona ngeglaucoma, njengodokotela wamehlo, yini kahle hle umlayezo enifuna ukufikisa or into enifuna ukuyifundisa ababukeli abasemakhaya?
So glaucoma awareness is an annual campaign esiyenzayo also here in South Africa as well as in the world. So it's a world awareness event where we sifaka emphasis on glaucoma, which is one of the many diseases zamehlo. Iningi into eyenzekayo emehlweni, ziningi izifo zamehlo, but we make this special week which is focus especially with glaucoma. Ngoba glaucoma isifo esivale abantu amehlo. Millions of people are blind from glaucoma and have gone blind and will go blind from glaucoma. So we make this time sifundise, senze awareness, siphoqelela abantu ukuthi banakekela amehlo ngaleli viki.
Usuyibeka nje kahle ukuthi it's a world problem. Kusho ukuthi baningi abantu abachaphazelwa yilesi sifo. Kanti masikhuluma nje ngekuthi i-glaucoma kusuke kwenzakalani elihlweni?
I-glaucoma i-group yezifo. It's a group of illnesses. Akusiyisifo esisodwa, but isifo sona sibizwa nge-glaucoma. But it's caused by many things. You know, i-damage yamehlo eyenzekayo kumsipha wamehlo. So we need to understand ukuthi ilihlo amehlo is an organ. So i-organ ine-system esebenza ngakhona. Ine-blood supply, igazi ukuthi lisuke emzimbeni lizofika emehlweni. Kunemisipha esuka from the brain eza emehlweni. Le misipha yiyo le enza i-connection between ukubona ne-brain. So kahle ukuze sibone kahle le misipha le kumele ibe healthy. So mayingaphilanga le misipha le ine-damage, i-vision yakhona iyahamba and you end up going blind from this illness. Ziningi ke izinto ezenza i-glaucoma ukuthi i-affect amehlo. But esikhathini esiningi kuba ne-build up ye-pressure. So njengoba wazi ukuthi emzimbeni umuntu angaba ne-blood pressure, high blood pressure. So i-glaucoma kahle esikhathini esiningi it's high pressure in the eye. Ilihlo nalo line-pressure yayo njengoba umzimba nawo une-pressure yayo. So this pressure over time ekuhambeni kwesikhathi ungathatha many years ukuthi isifo sigcine sibonakala in terms of decreased vision. Leyo damage leyo yale pressure yenziwa ngokuthi ilihlo normally liproducer into ebizwa nge-aqueous humor. So i-aqueous humor is a fluid ela emehlweni, amehlo ayayiproducer every minute. Le fluid lena isupply ama-nutrients to the eye, yenza ukuthi ilihlo libe clear, lenza ama-nutrients are-healthy abe khona emehlweni. So kune-system yokuthi le aqueous humor iba produced lapha emehlweni, and then it also leaves the eye. Kunama-channels, kunendawo lapho adraineka khona lamanzi esiwabiza nge-aqueous humor. So makwenzeka ukuthi le aqueous humor lena lamanzi angakwazi ukudraineka out of the eye, agcina enza i-build up lapha ngaphakathi emehlweni. That is what causes the pressure manje ukuthi ibe phezulu. Mase iphezulu le pressure icindezela le misipha le esibona ngayo. So imisipha is connected to the brain. Imithambo yamehlo are connected emzimbeni. So le misipha mayicindezeleka over time igcina ingasasebenzi, and that's what leads to blindness nale glaucoma le esikhuluma ngayo.
Kanti yini eyenza ukuthi kugcine kwenzeka le glaucoma, the causes, you know, ngabe yini ebangela ukuthi or mhlambe ibaphi abantu abasengcupheni yokuthi bangagcina ba-developa i-glaucoma?
Okay, so lesifo lesi is grouped into different groups. Inga affecta anyone really.
Nabantwana ingaba affecta?
Nabantwana ingaba affecta. So we have a group ebizwa ngokuthi i-congenital glaucoma. Congenital glaucoma ile ozelwe nayo. That means that when you were developing in the womb, umntwana masa developer in the antenatal phase, kuba ne development engenzeki kahle kule ndawo le edraina lamanzi ebesikhuluma ngayo. So umntwana makazalwa uzalwa vele le pressure seyikhona because ayisebenzi or ayizange idevelope kahle ma umntwana esa-formed in the womb. So leyo siyibiza nge-congenital glaucoma oba nayo usazalwa. So it is it can happen also in children. And then i-group elandelayo ile ebizwa nge-juvenile glaucoma. Juvenile, as you would understand, ukuthi we're looking at ama-teens, teenage years. So i-juvenile glaucoma ileyo eqala kuleyo minyaka yoba ma-teen years and your early 20s. Nayo ibizwa ile sibiza nge-juvenile. Kube nale glaucoma le eqala with age. Ile eqala probably mawusokuma noma 40 years. That's when usually the most common ama-glaucoma iqala from that age of 40. Then kube ne glaucoma le eqala se ukhulile nje over 60, over 80 years ebizwa nge-normal tension glaucoma. Yona leyo glaucoma is not associated ne high pressure emehlweni. Wonke la amanye ama-glaucoma engiwamentionile ahamba nale pressure ephezulu emehlweni egcina i-damage imisipha. Leyo khula okudala more than 70 years, leyo yona yi-degeneration kakhulu yomsipha egcina ukuthi enza amehlo angasaboni kahle. So as you can see ukuthi ama-glaucoma anema-categories amaningi. Kukhona nale glaucoma eyenziwa izifo zamehlo. So mangabe une-infection ebizwa nge-uveitis, kune-infection eyenza ukuvuvukala la ngaphakathi emehlweni ebizwa nge-uveitis. Yona ke yenza ukuthi kube ne-blockage yalamanzi because of ukuvuvukala ngaphakathi emehlweni. Yona ibizwa nge-juvenile glaucoma. Ebizwa nge-uveitic glaucoma. Kube ne-glaucoma ebizwa nge-neovascular glaucoma. Yona yenziwa izifo ezifana noshukela ne-high blood emehlweni. So there are many categories ze-glaucoma, but the most common one ibizwa nge-primary open angle glaucoma, where i-pressure iphezulu emehlweni. Leyo ongaba nayo usazalwa, ungaba nayo uyi-juvenile, the juvenile age, or ibe yi-primary open angle glaucoma le eqala masubunwa ma 40 years and going up.
Manje uma sekafikile umuntu uzozizwa kanjani ukuthi okay ngathi iyaqala impawu, mhlambe khona izinto azozizwa noma azozibona, kanti sibona lezo mpawu afika kunina yiziphi izinto enizomnceda ngazo nini?
Okay, so masifocusa kule ye juvenile. Le abantwana yona iyakwazi ukubonakala because amehlo umntwana ayakhala amehlo. Amehlo aba white. Athena white. This clear part of the eye it turns white and umntwana angaboni. So Leo it can be picked up if umntwana aya ku pediatrician, aya kuma check up or ebona ngudokotela wamehlo. The one engathi is very sneaky. Glaucoma vele isifo, it's a silent illness.
Okay.
So it's even called the thief of sight.
Okay.
Because iyantshontsha ungaboni and uthatha isikhathi eside ukuthi realize ukuthi there's something engekho right ngamehlo. So it's very silent, angubi na pain, and I think on a wider discussion ukuthi mele sikhulume ngale ndaba yo associate isifo ne pain. These things azihambi zoyi-two. They don't go together, especially emehlweni. If uzolinda kube ne pain emehlweni, you usolinde to the end of damage yamehlo. So let's not associate ukuthi makubhlungu kunenkinga. Makufiphala ivision yakho ubona ukuthi ivision yami angisaboni kahle, iblurry. Esikhathini esiningi abantu be glaucoma ba describe into abayingathi inkulu, bathi kune mist mangibhekile. Ngathi kumhlophe, it's not looking very clear. By that time, seyihambele kakhulu glaucoma that time. Masobona le mist lena is the last nerves imisipha so damage ke kakhulu sekusele kancane ukuthi ivision yakho ingacima totally. So glaucoma mayiqala nje, blurry vision is the most common symptom, but blurry vision ingakhosa noma yini. Ingako ukuthi mele siloko siwa check amehlo so that we can pick it up early, sikwazi ukuyimanage early before vision be completely gone. In a pattern ye glaucoma ye vision loss. This vision loss iqala in the periphery. Mawubhekile ungibhekile wena uyangibona straight, but izinto around you, izinto esecaleni, maybe mawucrossa umgaqo imoto uyazibona, but abantu nezinto on the sides, which is called peripheral vision. Okay. So peripheral vision hiyo ehamba kuqala mawune glaucoma, and then towards the end usala ne central vision. Central vision is ile vision le mawubheke umuntu uqondene naye. So mostly abantu bazo describe peripheral vision loss or blurry vision. That's when you know ukuthi mhlambe ungaba nenkinga umele uhambe uyochecka amehlo.
Manje nilapha kanjani?
Ukuyilapha iglaucoma kuqala ngokuthi mhlambe sikudiagnose ngayo qala ukuthi une glaucoma, ukuthi abantu esebenza nabo kakhulu abangayipick up abayiscreenayo ebumele ukuthi bayiscreene ngama optometrist. So ama optometrist they usually the first call or first contact umuntu makahlushwa ngamehlo. Abayi ku specialist abafiki lana kimi. Most of the time baqala bayobona optometrist basho ukuthi amehlo awaboni kahle. Optometrist ke umuntu odila nama specs ozokunikeza ama specs ukuthi i-vision yakho ibe ngcono. But mawuya kubo as routine examination baya check le eye pressure. Then mabe pick up ukuthi this pressure is high bazokuthumela ke manje ku specialist, someone like me ukuthi enze i-examination azokwazi ukudiagnose. So we work very closely nama optometrist because if i-problem yakho ayilungiseki ngama specs, then it means ukuthi kunesifo, there's a disease in the eye ekumele ukuthi attendiwe because ayisalungi ama specs angeke akusize nganix. So kumele uze ku doctor wamehlo azokuchecka azodiagnose ukuthi yini. So masidiagnose le glaucoma le kunama test esiwenzayo. Okokuqala ile pressure ephezulu emehlweni, we can pick it up ngokuyichecka ngemishini esisebenzisayo. Then sikufaka emshinini sibheke lo msipha siubone ukuthi une damage. Into okwazi ukuyibona as odokotela bamehlo nemishini esisebenzisayo siyayibona le damage masisenza i-level examination. And then kunama instruments esiwenzayo azobonisa vele le damage, athatha ama pictures wemisipha lena ibonise ukuthi i-damage ingakanani nokuthi sikwazi ukwenza i-follow up using those tests. So ekuqaleni what we call a baseline test, mawuqala ukuza ku-specialist enze wonke ama-test, and then masuqale leyo treatment akunikeza yona uyakwazi ukulandelela lesifo by examining you and doing the tests ukubonisa ukuthi ise i-controlled na i-glaucoma. I-glaucoma ke isifo esiqhubekela phambili. It's a progressive disease ngokwesilungu. So it means iya progressa, ayimi, akusiyinto emayo. So what we do is we control it so that ungabi na further damage to your vision. And glaucoma by definition is an irreversible damage to the nerve. Manje mawuthi irreversible, it means ukuthi ayibuyele emuva. So lo damage ofika nayo or eseyenzekile asikwazi ukuyi-reverse because lemisipha le those nerve cells sewafile, those cells zama nerves are dying one by one kancane kancane. So the ones that are gone already and have been damaged because of the pressure or because of the glaucoma cannot be recovered, they cannot be reversed. So mawusenza le treatment esifaka kuyo is to prevent further damage ukuthi ingaqhubekeki or to slow it down ukuthi sikwazi ukuthi sisave i-vision yakho for a long time.
Ingabe mhlambe kukhona ukudla okungenza ukuthi sikwazi ukunciphisa ukuthi le glaucoma ingabhebhetheki, or kukhona vele ukudla ukuthi mawukudla kukwenza ukuthi kube worse le condition? Kuhamba njani la eklini? Ngoba ngiyazi ukuthi masidla ama-carrots asenza ukuthi sibone kahle, mhlambe kukhona okunye ukudla okungasinceda.
Yeah, so ama-carrots wona ane specific part of the eye. Remember, ilihlo linama-layers.
Okay.
There are many different parts, different layers that are responsible for your vision. I-vision yakho ayidependi kumsipha kuphela, ayidependi kwi-macula kuphela. The macula yiyo ke le part ye-layer yelihlo erespondayo kulama-carrots. Mawuthi udla ama-carrots, i-beta carotene, which is a vitamin ekuma-carrots eyenza ukuthi i-vision yakho ibe healthy. So that's a different part of the eye. So for glaucoma nomsipha really akuna ma-vitamin ase-proven ukuthi ayayisiza i-glaucoma ukuthi ingenzeki or inga-progress. So at the moment akukho. What we offer at the moment ngama-treatment esinawo.
Okay.
So ama-treatment esinawo ngama-eye drops. Lawo ma-eye drops loyo ehlisa i-pressure emehlweni, just like i-blood pressure medication ehlisa i-blood pressure emzimbeni. So lawo ma-medication nayo asebenza ukuthi kwehle le pressure or ayincedisa le ndawo edraina amanzi ukuthi isebenze kangcono. Then kune-laser treatment. I-laser treatment akusiyi-operation, umshini nje onama-lights. Lawo ma-lights lawo a-treata this very area edraina lamanzi ukuthi ivuleke, idraine lamanzi better. And then kunama-operation ke. I-operation nayo yokwehlisa i-pressure lapho sivula khona imbobo encane ukuthi lamanzi akwazi ukuphuma njengoba le ndawo edrainayo ingasasebenzi. So we have many treatments to offer for glaucoma so that to slow down the disease or to prevent further damage yamehlo.
Umuntu njengami nje ngifuna ukuzipreventa ngoba sithi prevention is better than cure. How can I prevent ukuthi ngingagcini ngibe ne-glaucoma? Ngiwanakekela kanjani amehlo ami?
Okay. So kunama-risk factors we-glaucoma. Kunabantu abane-risk ukuthi bangaba nayo i-glaucoma. For instance, being of African heritage is a risk factor on its own. So African people are at higher risk of getting glaucoma. So we should take that seriously. Nabanye abantu ezinye inhlanga nabo banezifo zabo ukuthi bane risk more ukuthi bangadevelopa lezo sifo lezo. For instance, kunesifo esibizwa nge-age related macular degeneration. Leso sifo leso si-common kakhulu ebantwini abamhlophe.
Okay.
Uzothola ukuthi manje glaucoma i-common kakhulu ebantwini abamnyama, abantu bebala elimnyama. So they risk leyo. That's why manje wonke umuntu kumele anakekele amehlo. The other risk factor i-age. So i-age of more than 40, ilapho izifo usually ziqala khona. Mawuthena 40 because mawuzalwa you've started aging from birth. Mawuzalwa nje una 2 years, you've aged by 2 years. So mawuna 40, you've aged by 40 years. You've been around for 40 years. Umzimba wakho awusafani nale the time ubuzalwa. Izinto seziqala manje ukuthi zingathi azisafuna ukusebenza kahle.
Kahle mabethi life begins at 40. Basho ukuthi izifo ziqala at 40 kahle uma uzulindele izifo
kahle. It actually means ukuthi mawuna 40, your life begins. You must start taking care of yourself.
Okay.
That's exactly what it means. Start taking care of yourself mawuna 40. Because izinto ziqala kancane. Although most people are still healthy at 40, it's just an awareness thing. Ukuthi ube aware ukuthi okay, now I'm turning 40, I'm no longer,
the same.
The same. My organs are not the same. Everything is not as fresh as it was before. So things can start going wrong at that point. So from the age of 40, we encourage ukuthi abantu baqale bascreen. Although usually this disease is osbonakalisa maybe 5th decade, 50 so. But we encourage people ukuthi baqale early. And then the other risk is a family history. Okay, ufuzo. So kunento yokufuza ekumele si-understand as abantu abamnyama ukuthi ukufuza into oyithole from abantu bakini, whether from your mother's side or your father's side or umkhulu or ugogo ubani. Lesifo lesi sihamba la emndenini siyehla, and masihamba emndenini asisho ukuthi sizoniphatha nonke. Uzo-understand ama-genetics ukuthi ahamba kanjani, genetic diseases. Ukuthi anokuskipha ama-generation. Ungathola ukuthi ubaba wakhe akanaso lesifo but umkhulu bekanaso. And then as ama-siblings akusho ukuthi nonke nizoba nayo le glaucoma oyi-1 out of 4 maybe, or out of 2 or out of 5, depending ukuthi le gene lena, le genetic disorder le eyenza le glaucoma is strong kangakanani kule family or kini. So ukufuza ke abantu esikhathini esiningi bazosho ukuthi hayi umkhulu washona engasaboni, but ungazi ukuthi yokwenze njani. Mhlambe ileso sifo lesi se-glaucoma maybe sasingekho diagnosed or zange diagnosed that time. So ufuzo is one thing. Ma une-family history ye-glaucoma or ukhona umuntu one-glaucoma, we suggest ukuthi ucheck earlier than this age of 40. Ucheck maybe at the age of 30, a decade earlier. If kunesifo esikhona kini or enisifuzile, kumele ucheck a decade earlier, so that sizo pick up early and then we can manage it sooner.
Ngaphambi kokuba sivale dokotela, sike sahlangana nawo dokotela sixoxisana ngendaba yoshukela kanti ngizwile uyibala ushukela ne-glaucoma. Ngathi nakhona zikho. Kahle hle iziphi ezinye izifo ushukela esikhosayo emehlweni, and kanjani ukuthi ushukela ugcine sowubalekele emehlweni ukukhoze lezo zifo lezo ngokuhlukahlukana kwazo emehlweni?
So diabetes is the second leading cause. It's in fact, I think it's the first leading cause, number 1 leading cause of irreversible blindness in the world. And then glaucoma is the second leading cause of irreversible blindness in the world. So these two diseases are like in the top 5 causes of irreversible blindness. And I want to emphasize the irreversible part, because when you present late or you attend late izinto zakho, we may not be able to reverse, because ayi-reverseki, i-damage seyenzekile, umoshakala sekwenzekile, akusenakubuyisela emuva. We are trying to control and preserve your vision. So isifo soshukela ngithi isifo somzimba. Amehlo asemzimbeni, igazi elihamba emzimbeni lihamba emehlweni, right? Because the blood supply eyamehlo is from your body. So isifo soshukela isifo sama blood vessels kahle kahle. Angithi mawunesifo se-high blood, ama-blood vessels are stiff, mancane, aba narrow. That's what causes i-blood pressure ibe phezulu. Mawune-diabetes, ama-blood vessels are weak and leak. They leak easily because they are weak and they are dilated. They are not normal. So ngenxa yesifo soshukela. So lesifo lesi la emehlweni senza the same thing. Lama blood vessels ala emehlweni which supply i-oxygen emehlweni, supply ama-nutrients emehlweni aba weak. So mawe weak lama blood vessels awenzi umsebenzi wawo. Agcina ke manje le oxygen ingasezi emehlweni ebese ikhosa i-damage emehlweni. And mawalika enza i-bleeding ngaphakathi kwamehlo.
Dokotela, ungamxwayisa uthini umbukeli osekhaya namhlanje ngabantu especially laba abathanda ukuthenga imithi over the counter, uthenga ama-drops umuntu afake kanti ngaleso sikhathi i-glaucoma or isifo soshukela bo-cataract, bo-diabetic retinopathy, ungabaxwayisa nje uthini?
Ngifuna ukuthi umuntu ma amehlo engasaboni kahle, ungcono uqale, your first port of call is to see an optometrist. Ilabo bane-idea yokuthi ma beyibona lento le ukuthi kumele ukubona i-specialist bazokwazi uku-advise. Imitholampilo inawo ama-eye clinics. So lapha emtholampilo asambeni siye khona lapho kunama-eye clinic khona kuleso sibhedlela leso. Or uye ku-optometrist. Optometrist iyazi akakwazi ukukumanage nangakwazi ukukumanage. Over the counter ama-medication wakhona for generalized izinto ezingekho specific. I-glaucoma is a specific illness, i-diabetic retinopathy is a specific illness. So ma uya over the counter uyothenga, awuthengi into ezokusiza because ayikho directed to the illness that you have emehlweni.
Sithembe lapho mbukeli ukuthi uzifundele, uzwile, kanti ningakhohlwa ke ukuvula lapha ku-YouTube noma ku-Facebook ka Dr. Prue bese niya subscribe. Nisale kahle babukeli emakhaya.